I am Professor Wim van Biesen. I'm coming from the University Hospital in Ghent, Belgium. So knowledge is the key, which means that we will offer to the participants some knowledge on how to run peritoneal dialysis or home-based therapies in clinical practice. We will have a series of continuous medical education. We will have a series on how to, for example, perform a catheter placement or how to achieve sufficient ultrafiltration. We will also have the knowledge improvement in the basic science. Can we understand the working and the function of the peritoneal membrane, and how will that impact on how we practice peritoneal dialysis in the future? We will also have some series on how we can transfer knowledge that we have to the patient, so that patients can improve their understanding of the treatment and by consequence improve the outcome of those treatments. So if you look to that, there is different tracks that focus on these different aspects of knowledge, understanding of peritoneal dialysis and of home-based therapies, because I think that if we want to make really sure that patients get a portfolio of available treatment that they can tailor to their needs, that we also need to include home-based therapies, meaning hemodialysis-based therapies in our portfolio. And this is why we will also focus this year on transition between the different modalities. If you have a patient on peritoneal dialysis, there is some problems. How do you transfer this patient to home hemodialysis? How can you incorporate that from the beginning? If you have a patient who's in center hemodialysis, but for some reason would like to change to home-based, how do you organize that? If there is a patient on home-based hemodialysis, can we transfer him to peritoneal dialysis or transfer him to center dialysis? How do we see transplantation fits into this project? Because all these things, at the moment, there is very little information, and we need to expand our knowledge base on this because it's important. This is the real life of patients, and this is what we see in clinical practice. Now, as usual in EuroPD, we have a title, we have a kind of theme through the whole program just to link everything together. And this year we have opted for the theme, knowledge is the key. And knowledge is the key not only for the clinical application of what we do with peritoneal dialysis, how we place a catheter, how we do ultrafiltration, how we treat an infection. There is also more about knowledge transferred to the patient. How can we improve the understanding of our patients so they can improve their treatment and the way they perform it? There is also, of course, knowledge is the key for our personal understanding at the basic level of what happens to the peritoneal membrane. And if we can change something to that, or if we can influence it so that the therapy can last longer and that we can preserve the peritoneal membrane for longer. Knowledge is the key is also meaning that we have to expand our understanding of the patient trajectories, meaning that a lot of patients start on one treatment and they transfer to another treatment modality during their course. This is extremely important because it's at these transition points that some accidents might happen. So we need to expand our understanding of the integration of the different treatment modalities, the home-based therapies like peritoneal dialysis, like home hemodialysis, transplantation, and the center-based dialysis therapies, and how we can mix these together so that the patient has the ideal trajectory for this patient. So I think knowledge is the key, and there is a lot of facets to this knowledge, and there is different tracks in the program that will help the participants to understand the different aspects of these different traits through the program. Now, as people know, the last theme was about PD, personalized dialysis, which means that we will adapt the treatment to the patient and not the patient to the treatment. And in line with that, I think we also have to offer more information, knowledge about home hemodialysis, which will be a separate track in the program. And taking that into account, it's also more important that we understand how the transfer between the different modalities, peritoneal dialysis, home-based hemodialysis, center hemodialysis, and even transplantation can be incorporated in the life trajectory of the patient. So these transitions are also very important, and our knowledge base there is very deficient and needs to be upgraded. And this will be an important theme also that runs through the program.